I'm Kevin. Don't need much self-introductions. So what I would like to do is just briefly introduce every speaker this afternoon, and also welcome the speakers, especially those from overseas. We have someone from Melbourne Uni to join us today, this afternoon. So I'll just go down the list. Our first speaker is Dr. Meng from Department of Geography. And our second speaker is Dr. Yang Si from LEWI. And then our third speaker today is Peter Ko from University of Hong Kong, Department of Geography. And our last speaker of the day is Monica Tan from University of Melbourne. So we roughly have 2 hours today for these sessions, and so 4 speakers, 2 hours, so up roughly half an hour for each speakers. I think this is fairly relaxing, so don't need to rush. Hopefully we have plenty of Q&A time at the end. Okay, so without further ado, I'll pass the time to Dr. Gao.
Good afternoon, everyone. Thanks for organizing this very nice meeting, and thanks to Kevin for the introduction. Air pollution has been recognized as very important health risk factors, and we know that the major sources of air pollution are from burning of fossil fuels. And because in COVID-19 lockdown period, a lot of human activities were banned. As a result, air pollution might respond to that. So today I'm going to talk about a phenomenon we observed, that the ozone response to COVID-19 lockdown in China are quite different across different regions. So not just ozone, both ozone and PM 2.5 are 2 major air pollutants concerned by different governments. In China, in the recent decades, PM 2.5 concentrations were extremely high, and that has received worldwide attention, especially in January 2013. During that month, the maximum hourly PM 2.5 concentration in Beijing exceeded 1,000 micrograms per kilometers. And since then, the State Council of China announced, we call that a Clean Air Act, to beat PM 2.5 concentrations. And from observations across China, we can see since 2013, the concentrations have declined a lot due to this China's Clean Air Act. But at the same time, we observed the levels of ozone have been increasing rapidly after 2013, which is different from the trends in PM 2.5. And there are many reasons for that, for the increases in ozone pollution, because the formation mechanism and precursors of these 2 air pollutants are very different. The Clean Air Act was targeted for PM 2.5 concentrations, and ozone did not receive enough attention. And we care about ozone because it's very important in both chemistry and climate of our atmosphere. And when we talk about ozone, there are 2 types of ozone. Some of them are in stratosphere. We call them good ozone. And the ozone we are breathing every day, we call that bad ozone. For good ozone, they are in stratosphere. They are a very strong absorber of UV radiation. As a result, less UV radiation would approach us. If we receive a lot of UV radiation, we will have like skin cancer and other serious health outcomes. And the ozone stratosphere, most of them are absorbed. That's why we call those good ozone, because they protect us from getting skin cancer and other health problems. But for ozone near the ground, they can cause a lot of health impacts. That's why we call them bad ozone. And for near ground ozone, they are formed through photochemical reactions of nitrogen oxides with volatile organic compounds. The major sources of nitrogen oxides are from vehicles and power generation. And for volatile organic compounds, the major sources are from plants. They emit, their natural sources, they emit. If we have a lot of forest, they can emit a lot of VOC. And these natural sources of VOC react with human-made nitrogen oxides to form ozone pollution. And we have metric, we call that the radial forcing, to measure the intensity of air pollutants in terms of climate change. If it has a positive value, it means that it has a potential to warm the atmosphere. And you can see that ozone has a global average radial forcing of 0.35. It's the second largest greenhouse gas, just following carbon dioxide, CO2. And that's its impacts on climate, but it also has serious health impacts and also adverse effects on vegetation. And the health impacts of ozone was realized in between like 1940s to 1960s in Los Angeles. It was called the Los Angeles smog. It is very different from the London fog. London fog was caused by particulate pollution, burning coal, but LA smog was caused by photochemical reactions. It is the major air pollutants in LA smog was ozone, not particles. And the health impacts identified for ozone include like headache, burning eyes, throat, and so on. And recently, some other studies, they found that like trees, if they are living under high levels of ozone, you will observe that they will be damaged by ozone pollution. And it was estimated by some studies that exposure to high levels of ozone in China can lead to a yield reduction, which means that it might have some, might endanger the food security in China and other regions. And the rising ozone pollution issues in China and also in India are caused by like rising levels of precursors. We just mentioned that the major two precursors of ozone in troposphere include nitrogen oxides, most of them from vehicles. And you can see that since 2000, it has been increasing rapidly in Asia. And at the same time, the VOC, volatile organic compounds, also increasing a lot. And the sources of VOC not include trees. A lot of industry sectors also emit a lot of VOC into the atmosphere. And the rising levels of ozone precursors are also being monitored by satellite data. You can see the this like light green line shows the levels in East China region. It has been increasing a lot. That's why we can observe high levels of ozone in recent years. At the same time, the formation of ozone is also affected by particles in the atmosphere. In the past several years, due to large reductions in particles in China, it actually can promote the formation of ozone in China, because the surface of particles are a very important sink of ROX. If we have less particles in the atmosphere, then more ROX will exist in the atmosphere, which can promote the formation of ozone in the atmosphere. And but what are the implications for COVID? So during we know that the nitrogen oxides mostly from vehicles, and during COVID, because of the reductions in transportation, nitrogen oxides have declined a lot. But nitrogen oxides are not just precursors for ozone; they're also very important for particles. When they oxidize to become nitrate, they will become part of particle PM2.5. And here's a study done last year looking at the responses of satellite observed nitrogen oxides in East China. They compare the levels at different stages to previous years. You can see that the first column shows January 1st to January 23rd. The top panel are for last year, but the bottom panel are for 2019. You can see that before January 23rd, the levels are similar because the lockdown in China started on January 23rd. Before that, there was no huge changes in human activities. But after that, in 2019, you can see high levels of nitrogen oxides in China. But in last year, the levels were reduced a lot because lockdown started at that time. There were not many transportation. As a result, nitrogen oxides declined. That's the response of nitrogen oxides, and observations also witnessed the declines in PM2.5 in China at different levels of lockdown. That's the response of nitrogen oxides and PM2.5, but it was not clear how ozone responds to that, and the formation of ozone is more complex. You would probably expect that ozone would decline a lot because nitrogen oxides is the major precursor for ozone, and we observe a decline in nitrogen oxides. But actually, from our study, we observed that from normal days to lockdown periods, the last figure shows the case in 2020. Actually, in most areas of China, ozone concentration actually increased from normal days to lockdown periods. The only reduction is found in southern China. And for this study, we were trying to understand why ozone responds differently across China to lockdown measures in China. And we compared the percentage changes of ozone from normal days to lockdown for different years. And for most of the year, we observe similar enhancements. For example, like in 2016, 2017, 2019, we observe similar enhancements of ozone in northern China, and but the percentage changes are slightly lower than that in last year. And we use a statistical model to identify the drivers for these changes. And so in this model, it is the lasso analysis model. This model can identify some important factors for the response. And for the potential factors, we consider a lot of meteorological variables, including like temperature, relative humidity, and other like wind speeds. These parameters are quite important for formation of ozone. And we also consider the precursors in the model, including both nitrogen oxides and VOC in the model. And for VOC, there's no direct observations near the ground, and then we use the satellite observed formaldehyde, which are typical VOC, to represent that. And from this panel, we focused on three major regions in China: the Beijing, Tianjin, Hebei region, which is the North China Plain region in the map here. And the second important one is the Yangtze River Delta region. That's the Shanghai and the surrounding regions. And we also consider the Pearl River Delta region, South China. We studied these three regions because these three regions are the most economically active regions in China, and a lot of people are concentrated in these regions. And we compare the driving factors for last year and years before last year. So from 2015 to 2019, we use these years to represent normal conditions. And the last year is an unusual case. We consider that as the lockdown period. And we compare the driving factors for these two time periods. And for North China Plain, we found the enhanced ozone levels in last year was mainly caused by reductions in PM2.5 and NO2. And we will explain later why this can increase ozone. But for normal years, you will see that the increased ozone level in this region is mainly caused by temperature and the reduction in PM2.5. Because the high temperature can promote the chemical reaction rates of ozone. So from days before January 13, temperature was lower, and after that, temperature would be higher. If we compare ozone in these two periods, we will see an increase in ozone if there's no emission changes, because temperature would lead to that change. But for last year, it was very unusual. There's large reductions in NO2 and PM2.5 promoted the formation of ozone in northern China. And for Yangtze River Delta region, we found that both precursors and meteorological conditions play a very important role. When we look at the situation in last year, we found that the enhancement in temperature and shortwave radiation from days before January 23rd to days after that would lead to higher levels of ozone. But at the same time, we still observe that the reductions in nitrogen oxides can make that change. That means that the observed large reductions in nitrogen oxides from this study can actually promote the production of ozone. And for Pearl River Delta region, we did not see like large impacts from changes in NO2, but we see that the decreased intensity of shortwave radiation made that change. And I would like to explain why reductions in nitrogen oxides would promote ozone levels in China under lockdown periods. So we just mentioned that ozone formation is associated with emissions of both nitrogen oxides and volatile organic compounds, but their associations are not linear. We have this chart. We call that the chart to represent the control regime. For the response of ozone to NOx and VOC, there are VOC limited and NOx limited regimes. For VOC limited, that means in that region, VOC is very limited. That means that nitrogen oxides are saturated. And for this region, when we change like nitrogen oxides, ozone will not change much because this region is NOx saturated. If for this kind of region, we can only reduce VOC to control ozone. But for nitrogen oxides limited region, is opposite. For NOx limited region, we can only change NOx to reduce ozone. If we change VOC, it will go in this direction. Ozone will not change much. And so then we use satellites to identify the sensitivity regions in China. And we see that in the left panel shows the normal conditions, and the red one is the lockdown periods. For northern China, including for East China, including both northern China Plain and Yangtze River Delta region, in both normal condition and lockdown period, they are always they are always in NOx saturated situation, especially in winter time, because in winter time in these regions there are not many trees. They will not emit enough VOC. So these regions are always VOC limited region. That means if we want to reduce ozone in these regions, we can only reduce VOC. If we change NOx, it will go in the opposite direction. But in lockdown period, NOx declined. As a result, ozone will increase. That's the situation for North China Plain and Yangtze River Delta region. But for the South China, is a bit different. It's in lockdown periods because NOx declined a lot. And it is in the mixed region. It can be sensitive to both NOx and VOC. Then if we decrease NOx, then ozone will respond in the same direction, or you will not see a huge change in that because it is in the mixed regime. That's the summary of this study. We knew that in COVID-19 lockdown periods, human activities declined a lot, but we are not quite sure about how different air pollutants would respond to that. And in this study, we found ozone responded very differently across different regions in China, and we used a method to identify the driving factors for the different phenomena observed across China. And actually, this COVID-19 provided a very good that for ozone pollution control, because in reality, it's very difficult to reduce emissions to that large extent, but this very special situation can tell us for different regions we probably design very different ozone control strategies. That's it. Any question?
Yeah, we have time for a couple of questions.
Very good. We haven't looked at other studies, but I can tell you very generally. So the reductions is based on if the region is not saturated or not. For regions with very high emissions of nitrogen oxides, for example, like northern China, the major emitters of nitrogen oxides are power generation from power plants and also vehicles. These two totally can account for about 80% of the emissions of nitrogen oxides. And for developed regions, for most of them, they are in VOC limited region, so they will not observe this phenomenon.
Hi. Yes. So I would like to ask, did we not know that the northern part of China has already saturated the nitrogen part? Like this, well, I'm not a scientist, but I don't know if we already know this, then we have this pandemic and we can actually test it, or actually we didn't know, and now we know.
There are actually, yeah, we can use this like COVID-19 from observations, we can test it, but actually there are many other ways to test it using observations. You can, because from observations, you will see the fluctuations of those variables, and you can see like how ozone would change, for example, like at a very high VOC level or very high NOx level. If you have enough observations, you will see this.
Hello, Dr. Go. I'm just curious that your data shows that the data in 2020 and before. So I'm just curious, how about the situation like this year? Do you have any information?
Like, what do you mean? Like the levels of ozone?
Like, yeah.
It is already back to normal now.
Back to
Normal.
2019, the similar pattern.
And the previous year, yes.
All right. More burning questions? Okay, so thank you, Dr. Gao, for your excellent presentation.
Okay, thank you.
Learned a lot.
Yes, thank you for everyone for making this kind of symposium possible, and especially as it's hard time. It seems it's had more technical difficulties, and I'm really pleasure to have the opportunity to share some reflections on this topic, environmental health research and the COVID-19 pandemic, a turning point towards sustainability. So basically, this is a study and a presentation based on some LEWI's recent publication. And basically, this is a study based on a review of the current COVID-19 research. And we address it from an environmental health perspective. And also, this study serialized some lessons from COVID-19, like the interdependence of society, environment and health. And also we present an integrated framework for conducting environmental health research. And also we proposed some like guiding principles for conducting environmental health research. And we will address it detail later. So basically we argue that visionary leadership that facilitates sustainable policies and some kind of a holistic environmental health science viewpoint is required for our prepared for our post COVID-19 era, something like that. So without further ado, I will go through some brief introductions. And during these 2 days, I believe most of us already have a review of the current situation and what we can learn from it. So just briefly, this kind of pandemic was initially considered as a healthcare crisis, but as the time go by, during the process, due to the recognition of the interdependent nature and this complex of virus, environmental health issues, so this crisis can be more accurately considered like an global environmental health issues. Of course, this pandemic is dramatically reshaping our world, and it presents a huge challenge to ensure our long-term sustainability. And also, this current situation has made us to know that more clear that our own health and well-being are very interconnected and dependent on the health, not only to keep our own health, but also dependent on the health of the people surrounding us, the animals, and the planet. So there is an urgent need for research to address this kind of fundamental interdependence of society, environment, and everyone's health. So in this case, collective actions need to be taken to deal with this kind of situation. And we need to call for a holistic approach to dissect this kind of complex interactions within the various domains. So for answer and try to answer this kind of different complex situations, we propagate some research questions to address and for creating something like more sustainable strategy. And so this is our research questions want to address in this study. So basically, initially, what is the environmental, what is a concept environmental health mean, particularly in this domain and in this situation? And then what are the environmental health problems that COVID-19 pandemic has brought to us, and also how to solve it, and the key guiding principles for solving this kind of how to face this kind of complex situations, and how to attain sustainable development in the when this situation probably post COVID-19 era. Hopefully we will do some more preparation work. So firstly, we propagate a framework for this study. So as we mentioned, that the first because different concepts can have different meaning in different domain. So here, for define environmental health, so it does that. So we first want to know what does the environment mean. So we emphasize the environment here, just very narrow it for our analysis. First is a physical environment. This defines the environment as external conditions and surroundings that affect the quality of life of humans, animals, and planets. And also this kind of physical environment could include two domains like built and nature environment. So as we all were familiar with the nature environment, so the built environment here is want to address something like building spaces and transportation systems that are created for modified by people. So, so this is environment, not the result of human invention. So for the health, as we know that the interaction of the physical and the psychological and different elements of one individual's health. So this kind of health, both individual and in population levels, can have some impact of the health and well-being of all. So based on these different narrow definitions, so we come up with the environmental health problem we want to address and propagate the definition in this study is that the environmental health is address a dynamic and complex interdependence of environment and health within the socio-economic structure. So we hope that this could improve the understanding of the interconnection between different domains like social determinants, human well-being, and psychological environments of different kind of built environments, including, and also like we mentioned, like we want to better prepare for different crises we may face in the future and ensure a long-term sustainable environment. So basically, this is want to let this kind of interconnected systems across different domains and influence the balance between health and ecological systems. So based on the different domains we have analyzed, so we propagate a framework like this. We emphasize 3 domains as shown in this picture. So basically, we emphasize that the scope of environmental health research should not be limited to public health, as we can learn from this COVID-19 situation. So the contribution and the collaboration of the social science could offer great potential for improving public and environmental health. So this conceptual framework illustrates this basically these 3 domains like environment, like social, environment, and health, and address the implications of environmental health interventions in the reduction of social inequality and environmental degradation, and also the health inequities. So we move on to the next our research question. So based on this framework, we want to address and to analyze what are the environmental health problems caused by the COVID-19. Of course, from different concepts, from different domains, we can have different perspective. So this is our analysis based on the framework we just see before. So firstly, we addressed it from a society focus on what does it brought our social issues have risen due to this kind of global impact. So as we can see from these figures, and there are different kind of measures such as social distance, household quarantine, and the travel restrictions have been effective in limiting the transmission. However, due to this different kind like stay home or quarantine policies, that the workforce across all economic sectors has been reduced. So there is a sharp increase in the unemployment rate. And so there's a problem in this global unemployment crisis has brought here. So at the same time, the burden healthcare systems around the world have been struggling to respond to this global health emergency. So like the recent WHO global survey has found that 90% of the world's countries have reported that disruptions to essential healthcare service since this COVID-19 outbreak. And also this situation also challenged the food supply. And also it can be seen from different perspective, like the food availability, access, stability, something like that. And also, as we can experience now, one of the very social impact is like working from home of the online conference becoming the new normal in some sense. Maybe it will be a new page in our post COVID-19 era. And also not only for the social media, not only for the virus spread rapidly, but also the misinformation also spread quickly in this social domain. So, so next, we analyzed the environment impacts has been brought by the COVID-19. So we don't go into details as Dr. Gao just illustrates very detailed how the COVID-19 has influenced our air quality, and it has a global scale influence. And also we know that this is kind of impact is a short-term impact. It might become to normal after some like restriction policies. So the kind of trend might not be a long term. So this is a question we want to address. And this figure is just one figure. Some people live in India has shown like, and maybe you have you have know from the news that in 2020 April, and many people live in India, they can see the Himalayas for the first time in 20 years. So they are very, very exciting to see this kind of mountains, and they have no opportunity to see it before. So this is some situations for the natural environment, but also as we know that COVID-19 has brought some challenges to our built environment, because air pollution and air transmission does not affect the natural outside air pollution, but also the indoor transmission. So the pollution for the indoor is quite important. So it also poses challenges at all levels of built environment. So next, the health perspective domain, the complex problems has arisen from COVID-19. Just narrow it from the physical and mental health perspective. And we all know that these two kind of domains and of interactions can be interacted with each other, and they can influence each other. And also that it can be addressed from different perspectives, but especially for the vulnerable populations, they are at a high risk for COVID-19, like the elders and people have some underlying conditions, health problems like heart disease, and some people smoking, they may have more associated with adverse outcomes of COVID-19. And also this has many domains to determine the health of individuals. So basically, these different kind of domains, they are interacted with each other. Like we have already seen too many circles, and this circle, when it turn around together, it's all the very interrelated with each other. They are not just solely for one problem to solve by one perspective. So this kind of significant impacts of COVID-19 are not separate from socio-economical systems. So like this model summarizes the impact of COVID-19. And also it shows the importance of identifying these different kind of how it's interdependent, interact with each other. And hopefully we can recognize some how to recognize the pandemics and how these different kind of social, economic, and political domains of the health can influence our decision making. And so by analysis, a different kind of complex environmental health problems. So our next question is that what are the key guiding principles for environmental health research? And we try to propagate some blue map to guide us to solve this problem, to show some principles. And firstly, as we have emphasized that this is not one domain and one discipline problem. So firstly, it's very important that we should address it from a transdisciplinary approach, like we have addressed in this symposium conference at the beginning. So we all know this is very important, but also is a challenging approach. That this is kind of a transdisciplinary approach should be addressed not only to just to involve from multidisciplinary point, but it also combines the high integration of academic research from different disciplines and non-academic participants. This is kind of integration, and some kind of stakeholder involvement in this process is quite important, and it's not important in one level, but hopefully it could be characterized by all the levels of the research process. So another principles we want to address is based on this transdisciplinary approach. We emphasize embracing complexity and uncertainty. And of course, we know that from this situation, this crisis is a striking example of the complex environmental health challenges and with unpredicted aspects, and we all influenced by the coronavirus in different ways. So this is a quite complex a problem from different perspective, from public health, economic, and political context. And rather than keeping it simple, scientists need to encourage to embrace the complexity and face the uncertainty by conducting research and interact with decision makers. So we know that this is alarming, so it's very important for us to accept that we need to, important to develop the capacity to live something like more humbly, harmoniously, and reasonably and healthily, and have the courage to embrace this complexity and face uncertainty with a positive attitude. And maybe we need to, then we can lead to better preparations for the next crisis. And this could help decision makers to respond more effectively in this uncertain world. And the third principle we want to address is addressing the vulnerability. As we mentioned before, the vulnerable groups, populations, is more inclined to be affected by different kind of situations from the crisis. So it's an urgent need to address the vulnerabilities from them and from transdisciplinary perspective. And then we can identify appropriate adaptation strategies to minimize this kind of inequalities and promote sustainable development and equality. So in the environment of the research, we address a vulnerability not only from only the impact of exposure and sensitivity, but also the adaptive capacity. And we want to address from different levels like social, environmental, and health vulnerability. And also combined with the addressing vulnerability and the resilience, is boosting the resilience is quite important in this process. This implies that we need to apply a more vulnerable systems, and this system is less vulnerable when it is more resilient, apparently. And we hope that transdisciplinary approach and resilience objects are being rapidly developed to inform and improve our decision making under the principles of addressing different kind of vulnerability and promote resilience. So we hope that it could be a turning point to navigate the socio-ecological transformations towards sustainability in this after the crisis. So all in all, these different kind of principles with target to the sustainable development. So how we achieve it? So we hope that the scientists in generating more forward-looking contributions and translating the findings into practice and take both pre-imperative and adaptive actions to protect the world from the outcome of COVID-19. So this kind of 5 principles is based on the identification of the transdisciplinary nature of these complex issues, accompanied by the uncertainty, and advocate addressing vulnerability, boost resilience for sustainable development. So this is our addressed principles. So lastly, we have some policy implications we try to propagate here. That we propagate that hope this kind of lessons we learn from this pandemic could provide insights regarding visionary leadership that they can facilitate sustainable policy development based on environmental health science. And we hope that these proposed guiding principles can support the implication of long-term and effective strategies to assess policymakers in coping with future crises similar to this global pandemic. As we discussed this morning, that we hope that we're not just hope that this situation will end very fast, very quick, but also we need to be more alert and prepared maybe for the next crisis, and we can respond very quickly. And so this will help us in the process of achieve effective, sustainable transformation. And also, of course, this kind of different kind of policy making decisions should based on some collaborations and international scientific cooperations. And we should need to strengthen as a community our practice to walk the talk and create the implement integrated strategies with sustainable development goals and their impacts on global health and socio-ecological systems. So lastly, there's just some very brief summary of this talk. And so from this study, we addressed that environmental health research is based on the different domains of individual subjects and highlights the interdependence of society, environment, and health at all scales. And we proposed an integrated framework for analysis in environmental problems arising due to COVID-19. And so we also, based on the framework, draws on this different kind of complex environmental health problems caused by the COVID-19. And next, we provide 5 guiding principles, including employing a transdisciplinary approach, embracing complexity and uncertainty, addressing vulnerability, boost resilience, and promoting sustainable development. And we hope that we can use this kind of a more holistic view and studies to safeguard and improve the whole well-being of the society, environment, and health. And also, we hope this study can be served as a kind of a consolidated guide to help professionals and stakeholders conduct environmental health research in this challenging time and field. So that's it. Thank you all.
Hi, Xi. Thank you for this presentation. I just wondering, when you're talking about when you're talking about uncertainty and complexity, so do you have any further thoughts on that? Like when we do not really know what to do, like at least like in the very beginning of the pandemic or even now, what kind of guidelines that we can follow? Is that like more scientific or more ethic, or like do you have maybe something to elaborate on that? I'm just curious.
Yes, just some maybe a very good question. And yes, actually this is but some of them problems is more brought by COVID-19, but like the complex and uncertainty as you address, it's not a new problem. It's like all-pervading problem. It existed before COVID-19 and will continue after COVID-19, right? So this is question, I think, for the policy, for the different level, we can address it for different perspective. And for, I think most of us, as very basic point, just to have awareness of this situation. And then will be not very easy to disappointed when the things are not go as we not as this direction. So so basically, if we aware of this basic situation, and so maybe people will have the more bird's eye view, and they will embrace the different situations and to have a much larger picture. And when they do some policy making, and for individuals, they'll do some individual planning. So basically, this is just my personal reflection. Thank you.
Okay, I have a question. I'm very interested in the collective action. This is a concept you mentioned in the introduction. So I want to listen to your opinions on, yeah, actually I agree that the environmental health problem is really, is essentially a collective action problem for the government, for the people. And so I want to listen to your opinions on the challenges that faced by, the collective action. I just want more elaboration on that.
Collective action?
The collective action, what challenges will we face?
To practice this kind of research, transdisciplinary research, am I right? The challenges.
Yeah, the challenges.
Yes, actually there can be many challenges, and I think basically, like we said, if we really want to cut through the different domains, like if we proposed like this interdependence and the transdisciplinary approach, but if we really narrow down to the earth, we practice it. Maybe it's really hard when we practice. It's not that easy. So I think to how to collaborate with each other, I think in this case there should be a more, like we propagate a more very visionary and leadership could lead a whole project, and then different domains people can really collaborate each other and really have some knowledge integrations and really have some efficient stakeholder involvement in this process. So this is my personal point. I think maybe in this process, a great leadership is very important. Thank you.
Good afternoon, everyone. So I'm Peter Ko from Department of Geography, the University of Hong Kong. So today, I just want to share one of my recent, studies about how data science, especially machine learning, can be applied in the domain of public health. About the media reports during the pandemic situation in South Korea. So, yeah, so this study is quite preliminary study, but it is supposed to, publish it soon, but in Korean journal. So if you are a fan of BTS or, Kingdom on Netflix, probably you can read. But Korean language is one of the difficult language for foreigners. So I can explain a little bit more today in English. So anyway, this study is performed with my two colleagues in one of the Korean university, Chungang University. The research step and then funding is from that university, and then I invite in there, provide some the guidelines and ideas about and the research methods of this study. So this is it. So okay, so let's go into the detail. So do you remember what kind of the news did you have last year around this time before, right? So lots of the panic buying issues all around the world, right? Even in Hong Kong, Korea, United States. And my personal experience last year is actually I visited my family in the United States during the Chinese Lunar New Year days. And then some of the colleagues in Hong Kong actually asked me to buy the face mask in the United States because we are already ran out of the stocks. But I visited lots of the stores in there. There is already all masks is already gone even in the United States. So then, that's actually what's going to happen in there, right? So this time, when I read newspaper articles, and then I just found that two different categories of the newspaper. One is really, really informative. So what kind of mask do you wear, or when do you wear, right? So what kind of material right? The level of the quality of the mask is necessary, something like that. Very, very science-based in-depth report. The kind of reports are quite also available at the time. But at the same time, many newspapers, like many newses are actually always blame about the government, blame about the companies and something like that. So then I just wonder how we can, check this kind of issues using the data, right? So because anyway, now everything is available online, right? Now we can, assess the news on the online, right? And then there are lots of the good analysis methods out there. So that's my, study questions from the beginning. So, so then I will just, have more details in Korea's situation at the time. So Korea's first COVID-19 case is actually imported from the Wuhan. And then finally it is associated with one of the weird sect church at the times. So, and then one of that sect church's branch located in Daegu in the middle south northern part of the South Korea, we have lots of the infection at the time, and then later infection is spread to all the other areas from the especially international travelers. So anyway, this is what happened in there. So in January, February, there are lots of these issues, mask panic banning, and then also we have lots of the shortage issues in there. So even in rainy days, people need to be making a queue and then waiting their turn to buy the mask. But, this is kind of a little problematic situation because, if you visited lots of the stores, you can have more masks. So then later, the government implemented their own interventions. So they make 5-day rules. So as you can see here, so like, it's 1627384950. Like here. So what this means is actually your national ID number ended this number, and then you can visit pharmacy or post office or agricultural union operated supermarket, and then you can buy 2 masks. Okay. At that time, so you can buy the 2 masks. So then, so each day with your number, then you can visit, or you cannot make it that day. You can go to the weekend and then buy the 2 masks. So that 5-day rules existed from the March to the July, and then early July they have enough masks at the time. So this lifted is gone. Okay, so that's what happened in there. So during that time, people was really got mad. So some talented student making this kind of app. So then you search your nearby, pharmacies and supermarket. This area has enough stock of the mask, and then no mask and something like that. But one of the issue is actually Korea's mask problem is actually they use too thick mask. So they call it KF94. So it's like really more than medical qualities of the mask. You can buy, in here in the Hong Kong too. So if you wear this mask, probably it is really difficult to talk, and then you have lots of steam in your glasses, I guess. Yeah. So that's so many, the scholars think that if, the Korean government, the government selected to use the just medical, mask like this, then probably they finish it earlier of this panic mask buying at the times. Anyway, so that is the background information. Okay, so then. Yeah, and then people get mad about it when they read the newspapers and watching the TVs and like this. So one issue is actually now Korea's media environment is really changing. So like many other countries, now people read more news from the online platform. And then actually in Korea, we have 2 large Google, Yahoo style of the portal site in Korea. So one is a Naver and one is Daum. So you just access their website and then you can read the news directly in their format. So all the media companies actually provide the news to the platform, and then the platform actually calculate how many people watch this news from their website, and then they pay back to the media. So that is now Korea's system. So now, news is also kind of old style of the news, news outsource, and also, this time is really long time ago, right? So now, people don't read the newspaper from the paper itself, but they just have the news like this. Okay, so that's that. Yeah. So then, this is my actually from the beginning my research question. So these news, do you really deliver useful information for the people in depth and scientific way, or they just report some non-meaningful, just one-day gossipy issues in there? Okay, so then how we can know the kind of differences using the data? Okay, so then if we can know that how the media may actually contribute solving this COVID-19 situation by the public health communications. Like Dr. Yang said, we need kind of collective, corporations during this COVID-19, right? And then media should be one of the important, right, sources to share the information and then share the sentiment of the people. But this media is really help for that. So that's my research questions about these studies. Okay, and then this is the research method we use for the analysis. So there is the one research method called topic modeling. So this is quite common in computer science. So do you remember that you watch some YouTube video, one thing, and then similar thing happen again and again, right? So actually they're using this kind of similar technologies in there. So basically, so this is just to think about it, this is a news, okay? What you read from the source. And then there should be some important keyword in there, right? And then each keyword have some different meaning each other, right? So for this one document, we have, different topic, or, we could say idea or keyword, something like that. So there should be some different topic like this. And then each topics, there should be different distribution of the words used in their, in these writings in there, right? So in topic 1, some words using more frequently, topic 2, the other words using more frequently, something like that, okay? So then this process actually automatically capture how many topics in there, this document, and then how these topics are related to each other. They calculated some of the, statistical, method, and then, all these automated processes in the programming. So for that, usually we need this kind of process. So data collection, meaning we need to have lots of the news articles from the source. And then we need to have clean data. So this is like, we only need the meaningful words. So in the document, some words are actually only for the grammar, right? So we don't need a grammar, the type of thing. So we only need really important words in there. And then the process, this topic modeling process, categorizing the words, the topics, and then finally calculating how, related to each other. And then finally they visualize the result. Okay, so this is the topic modeling processes we use. So there are some of the different, topic modeling method in there, but we used this one, latent declare allocate. So we said LDA, topic modeling method. This is one of the popular method in that field. Actually, I don't know, but they teach me that. So anyway, so then this is one of the method. And then for this process, we use the Gensim, the software, and then Pi Davis. So this is another software for visualization. Okay, and then what we need is actually now we collect the news, right? And then we sorting the data, and then doing some processes, and then we will have this kind of result. We will see later more. Okay, yeah, and then this is the data and then study period. So this is the Korea's COVID-19 confirmed cases from February to November 30. This is our end date of the study. So this is like so this is just arbitrary days for us so at the time. So we can extend more time definitely. So anyway, what we found that is actually we have three different waves. First wave and second wave and third wave like this. So this first wave is actually is because of the weird set churches at the times. So this is one, and then the second is also another the church groups which involving some conservative political events around at the time. So they have some gatherings outside, and then they have some another infection at it. And then this is the end of season. So we have the Halloweens, and we expecting Christmas, and people just get excited and just go outside. So that's really another the hike in there. So anyway, so we just check that which day is the highest infection day at that each three different wave, and then we just collect the data from the before 7 days, after 7 days, like this for our convenience. So if you have more step, if you have more bigger computer, then you can definitely extend the date more. So anyway, this is what we did in there, and then so this is 2 weeks, around 2 weeks. So anyway, so around 6 weeks, we collect more than 200,000 the news articles. And then finally we cleaned, and then we just have 9,566 news articles in there, and then this news is coming from 6 major newspaper companies and 3 major TV stations. Okay, and then this is the portal site. Neighbor, probably this character line, right? So that neighbor is actually own this company. So in here, this is their news home. So we access this news home, and then this is the search the box, right? So in here we typed some keywords. So in our cases, we just want to have have news related face mask. So we just type mask, and then we have all the news from there. Okay, so then and then I need to explain a little more in here. So then what we have from this analysis actually this one. So these circles meaning actually what kind of topic is more, the prevalent, meaning more frequently reported by the media at the times. Okay, so bigger one is actually more covered by the media. Okay, the smaller is only some small number of news in there. Okay, and then distance of these circles, meaning how that 2 different topics are related to each other. Okay, so then for this process, and then this one is actually each of these different topic circle, how many the keywords, and then in there, and then how these words are distributed in there. Okay, so this is the process in the software. Anyway, we did, and then we have 3 different times of the result like this. So first wave, so February 22nd to the May 7th. So as you can see here, right, number 10, number 8 is actually attached to each other, right? So meaning probably these 2 news article, topic is quite similar, okay? And then also 4.1 is also somewhat similar, this thing. And then 2.6 is also a little similar like this, okay? And then this is some important, issues, but not that related to other, topics like this. So anyway, and then in here, you don't need to concern about the location of the circles. You just see that how the circle is big, and then how the circles actually attached or merged together in a group or not. Okay, so then that's it. So anyway, as you can see here, number 10, number 8 is quite a big topic at that time. And then the word frequently used in this time in 10 and 8 is actually sale, supply, government. The Daegu is the area we have the, the origin of the first wave at that time. And then, today, I don't know why then. Anyway, the sale, export, supply, public restriction. So, and then the other circles like in here, 2.6, supply, sale, post office. And here, the Hanaru Mart and then pharmacy. So as you can see here, the most media report is, the focusing supply, right? The government, or somewhere you can buy the mask, right? And then the reason why they have some restriction and export is actually until that time, Korea companies can export 50% of their production to other countries. So that's why many Chinese, the companies approach Korea and then wanted to buy the Korean mask. And then that was, there is potential issues in that time in Korean people. So later, the Korean government stopped the export. Okay, so then their new rule is actually 80% of the produced mask in Korea was only inside in Korea, and another 20% can be exported at the time. So anyway, so this is at the time. Most about this actually mask production, distribution, regulation, such a thing. And second time, still we have some, the topic is quite related to each other, right? But as you can see here, now some topic becomes something small and then they have more distance each other, right? Than the first one, right? At that time, the keyword is actually responsibility, administrative order, right? Wearing indoor, this kind of thing. So this, words actually means around at the time, Korea government make mask wearing mandatory, order. So if you need to be indoor, you need to wear the mask always. So before that, actually, the wearing mask indoor is not requirement, not mandatory in Korea. But around at that time, they make the rule. So now, public media just report about that. But in here, now we see something very weird words in there. Where is it? Assault, okay, and driver, unmasked. So this word meaning actually around at the time. So people use, sometimes found each other. Why you are not wearing the mask in my taxi, my restaurant, something like that. And then they have some, the violent event at the time. So that kind of thing is now started reported at the time with a bigger, the importance at the time. Okay. And then finally, the third wave, you can see here what is the most, distinction about the two period. Now, no topic is actually overlap, right? And then what is the other thing? the circle size is almost the same, 17382, right? So now different topic, differently reported in terms of this mask. Okay, and then the funny words, let's finding some funny words in here. USA. Why the Korean people worry about the America's mask situation? Yeah, around at that time, around the Thanksgiving. So then, still United States have some problem with the mask and then mask violence. So that kind of news actually reported in Korea. And here, college entrance exam. So regardless of COVID-19 situation, the people worry about the college entrance exam usually implemented at the times. And then see here, another words like also taxi driver. Yeah, you definitely see that some taxi drivers are beaten by some people like this. Right. So, using this process, we just definitely know that, what kind of the report is actually provide from the news, right? And then also how that the words actually connected each other 3 different times. Okay. So, yeah, this is the quick findings. So, yeah, different news topic changes 3 different times. Okay. And then one thing we may, evaluate some good roles of media in first way might be, most of the, this news is concentrated on the, this production, supply, that kind of thing. So probably government got some kind of external pressure from them. And then they probably try to make more mass at the time. So then in some sense, maybe, the media might be contribute to, finish their panic buying and all this mask production problem relatively short time. So from the July, they don't have any issues, right? Even with the thick mask, right? So maybe there could be one thing, positive thing from the different news, but later in stage, we couldn't find any in-depth news, but we have more superficial, just gossipy one-time event from the news. Right. So, this might be an important, lesson for us that, what is the role of the media or, how the government actually need to work together with the media for this public health communication, right? So if you really wanted to have more, meaningful public health intervention, then you need to work together with the media, but in good ways. Right. So this is something, we can find these studies. So anyway, we can use this method with some other topics. Yeah. And then, yeah, especially, if we can combine data science, public health, and social science, then we can, do some more meaningful studies, in the later. This study has some of the limitations in there because, we only analyze some, specific time over the, the period because of the computing power and etc. But definitely, we can get around this issue if we have more time and resources. And then we just report, analyze the traditional legacy media. But yeah, if you want to have more, data source from the, Facebook and whatever, definitely you can do actually. So then you can compare. And then maybe, our study area is only Korea. So maybe we can do this thing in Hong Kong and United States and then compare each other. Then maybe we can have some other idea for these things, right? Yeah, okay, so I think this is the end of my presentation. Okay, yeah, thank you.
Hello. Hi. Thank you very much for this presentation. I found it quite interesting.
Thank you.
So I actually came across another study in the Netherlands, like just a few days ago, about the media coverage of the code black situation, like with the hospitals full, what could happen when there's no beds, and then some decisions to be made, and then how the media a response to this kind of situation. And I found that's quite in contrast with the result, like this study you're doing, which is very interesting because in the other situation, it's more like in-depth discussion and all the like medical ethicists talking with each other, or politicians make it political issue, and then how people think it's not supposed to be political and supposed to be more ethical. And in this situation, I'm wondering in your research first, how do we know if one report is in depth? Like, how do we define that? How do we do it from the big data mining?
Yeah.
And then the second is, how do you think there's a fewer discussion, in-depth discussion, or like ethical or morality related in this kind of debate, and why is that?
Okay, yeah.
Thank you.
Yeah, thank you. That's really a good question. Yeah, I think the first question about which type of the research is in-depth or not is actually, I think if we can, see that the result, then, we can see some distribution of the words in there, then definitely we may know. So for example, yeah, so as this is the number of topic in here, but actually, in this, software, actually, we can also see the distribution of this word in there, right? So then, if we have more, scientific words or more like, academic words in there, then definitely it should be more in-depth report, because people analyzing these things. Actually, I expect some other keywords like quality or filter and something like that. Actually, I expect that, sometimes probably people concerns about the media report is also cover that kind of thing, but definitely not. So yeah, so that should be one way we can know which one is, because, and definitely in here, the second wave, third wave, the taxi driver is actually definitely not that academic word, I guess, right? So yeah, that's one. And then what are the second question?
And maybe do you have any thoughts on why there are less in-depth discussion in South Korea in this kind of situation? Like, why it's supposed to be like a situation when citizens or media say, I don't know, Happy Mussington, maybe public forum for communication. But instead of that, we turn it into a gossipy situation. I'm just wondering why is that?
Yeah. Actually, this is all because of the Korean politics. Yeah, because now our ruling party is more like a little liberal, more democratic. The type of the group of the people, and then the other is actually the opposition party is actually they have more roots from our former authoritarian governments, and then more company, the corporate, supported the group of persons in there. And then two groups confliction is really quite fierce. So during this time, every time the government did something very good, they don't evaluate. And then they did something very bad and something small bad, and then they criticize a lot. So I think this is also, we can see some of the kind of harsh, political environment in Korea. So I expect that if we can use some Western countries, more, traditional legacy media like BBC and New York Times and some that kind of media, then maybe we can capture more kind of scientific, less political, more scientific words. But in here, in Korea's cases, it seems like they just making some more conflict each other, but, not, providing some more scientific, uses. So that's what I think. Yeah.
Can I also ask two questions?
No.
Can you hear me? Hello, can you hear me?
Yes.
Can I ask two questions? My first question is about the method. I think I probably was lost at some point. What are those topics? And because we can see same words on the group on the different topics, so how did you extract those topics?
This topic is automatically processed from this software. So from the beginning in here, so in here, how many topic you want to, you just check that, and then there should be some other parameter we can put inside. I don't know. Yeah, somewhere you can also adjust, some of the metrics in there. Then this, the circle, this topic is automatically made in this software. So actually, we don't have any, the opinions or intervention in this process. So this machine learning process just to make this result.
Yes, I see. So they are like latent variables, like similar. Those latent.
Yeah, so it seems like the whole. So for example, in here, this circle have whole different the distribution of this word, and then we can guess it's actually number 10, number 8. These words, the distribution quite similar each other. Then they have more related to each other. So that's probably their process, I guess. Yeah.
And my second question is because you covered like 6 newspapers and 3 televisions. So did you find any differences between these different sources?
It's a really good question because actually maybe that the different level or different type of the company may also depending on the quality of the data, definitely. But in this here, this 6 newspaper company and then 3 is actually one of the higher top level of the Korea's company. So we just think that these companies might be more reliable than other more than 1,000 media companies in Korea. Yeah.
Thank you.
Yeah.
Thank you. Thank you for your presentation. I think my question is kind of related with Monica's question. So you say you choose 6 newspapers. So according to how do you choose the newspapers according to what standards? Because I'm wondering if these 6 newspapers have different ideology or financial resources or the connection with the governments. So how do the differences in the media influence their report? Maybe they have different styles of reporting. Yeah. Some media prefer to report in-depth analysis. Some media just so how you select the media and how the different attributes of the media influence the report. Mm-hmm. So
that's a great question. Yeah, actually. For this, actually, we used one of the annual Korean survey about media reliance survey in Korea. So that we see that the rank, and then we take, oh, this company is still okay, then we just choose like that. Yeah, higher ranked company. So that kind of the the more reliance from the public, maybe their quality of the news. Anyway, previous times could be good, I think. So that's why they evaluate higher. So that's why we select more higher companies. Yeah. So it's like there are lots of the measure in media field. Actually, I'm not a specialist in there, but there are lots of the questions like how many times you assess this media, and then how reliable, and then what do you think this is the scientific? There are a bunch of the questions to measure the reliance of the media actually. Yeah. And then that is kind standardized method for all countries. So some I don't remember probably Nelson something company. So that company actually do that kind of survey for each country. So then they make some kind of rank. Yeah, so we use their survey to select these 9 news outlets in our study.
But additional point is that I think we justify why you choose research.
Yeah, that's true. But that is more, I think that is a kind of different rely on the definition of it. So, in these things, actually, we wanted to making some kind of the good, kind of the systems. So, the government, share some good information, and then the media, to provide that news more scientific way. So that kind of reliance, I want to use that, right? So then people really rely on that news, right? So for later, yeah. So that's what my concept is. Yeah. Yeah. Thank you.
So first of all, I would like to thank Kevin for inviting me to present today, and I really appreciate this opportunity. And I'll share the findings of a small collaborative research project that I conducted last year. So the title of my project and also my presentation today is Coping with COVID-19 in Rural China, Lockdown Experiences in Henan and Hubei Villages. So let's begin with some background. In late 2019, there were initial reports of a mystery illness circulating in Wuhan, and we all know that's COVID-19 now. After China recognized that there was a serious problem and the virus spread very quickly and the situation in Wuhan was terrible, the Chinese authorities cracked down very hard. Since late January 2020, a series of very significant restrictions were rolled out. Transport links were cut and very strict lockdown measures were implemented, first in Hubei and then also other parts of the country. And the spread of the disease began to plateau around mid-February. And since late March, lockdown measures were gradually relaxed. And so this is pretty much the timeline of the first wave of COVID-19 in mainland China. Around that time, the first few months of 2020, opinions were polarized on the strict measures in China. And news reports in Western media tended to criticize the oppressive nature of the lockdown measures taken. But conversely, especially before the COVID-19 became a global pandemic. But conversely, Chinese authorities insisted that the aggressive lockdown strategy was necessary for the country to win the battle against COVID-19. But despite the debate at the time, there was actually limited understanding or news report about how individuals inside China, especially rural residents, reacted to the government's handling of the pandemic. So we formed a research team. We wanted to understand how the lockdown was implemented at the grassroots level and was received in rural China. Our project involved 2 rounds of interviews. The first round of interviews was conducted in Henan between May and June 2020. We chose Henan because we read from the Chinese news reports that it was pioneering in launching the strictest restrictions in rural areas among all the Chinese provinces. Very radical border control was very common in Henan villages, with residents barricading themselves, destroying gateways and blocking roads. So one of our China-based collaborators traveled to 2 Henan villages at that time after the domestic travel restrictions were relaxed. And he conducted 16 face-to-face interviews in those 2 villages, including 4 with village leaders and another 12 with villagers. And in August 2020, we got a small grant to scale up the research. So we conducted the second round of interviews in 4 other villages, 2 again in Henan and the other 2 in Hubei. Again, we did 8 interviews in each village, and this time totaling 32 interviews. And in these 2 rounds of interviews, we asked similar questions and with the same purpose to understand how the experiences of rural residents during the lockdown and their responses to the restrictions imposed on their daily lives. So here's what we found. Although Hubei and Henan were 2 of the worst hit provinces during the first wave of COVID-19, there was actually no confirmed case of infection within any of our case study villages. However, very strict forms of lockdown were adopted. Roads to village main entrances were blocked by guards consisting of officials, village doctors, and volunteers. And mandatory quarantine was imposed on those who returned from Wuhan and other urban areas in Hubei before the Chinese New Year. So as the photo here shows, this type of poster was hung on the doors of the households with individuals who were quarantined. Basically, it was to urge people to avoid any contact with them. And further, government officials and volunteers regularly patrol the streets, sometimes in a patrol car, something like this, ordering people through loudspeakers to stay at home. In one village in Henan, which is very small and just next to the urban areas, the entire village was under video surveillance cameras. During the lockdown period, anyone who left home would be warned through the village loudspeakers to return home immediately, and they would be criticized in the local WeChat groups. And village leaders and local volunteers were extensively involved in the organization of collective purchase of food and other essentials. In one village, for example, the village committee set up a WeChat group for residents to make orders from local stores. And the committee members worked very closely with the local store owners and volunteers to organize the purchase and no contact delivery of food and other essentials. So when residents order something that the local store could not supply, the village committee would arrange a collective purchase from the markets in the closest township. And in 2 other villages in Henan and Hubei, similar arrangements were made so that villagers did not need to leave their home at all during the lockdown period. And but despite being very restrictive, these measures were to a large extent accepted by local people. Our respondents suggested that they observed very few cases of rule violations and noted that the villagers were generally calm and the village was orderly. And a few interviewees added that at the beginning, there was resistance from some villagers who found the lockdown to be inconvenient and were unwilling to follow the rules. And in these cases, the village committee members and frequently also their own family members would go to persuade these people, and typically emphasizing the dangers of the virus. And this was often pretty effective and was enough to change the mind of those people who were not very happy at the beginning. And overall, as the quote here suggests, the response was very positive. And the most negative response we got was, I don't think the measures were effective, but nor were they ineffective. We didn't have any COVID cases from the beginning, so I can't judge. But as we can see, this response demonstrates a mild suspicion, which is still pretty far from very clear opposition. And most notably, the villagers indicated a deep trust in the government's commitment to their well-being. And many identified with the popular saying on the internet, make contributions to the country by staying at home. And the 3 quotes here all illustrate this point. I'll just read one here. You see, the central government has put considerable effort and made huge economic sacrifices all to put this pandemic under control. Think about how much the country has done. What else can you say? The government is more worried than anybody. And the other two codes listed here basically demonstrate the same message, and they show very strong and positive sentiments towards the government. As we saw the very strict measures on the one hand, but very high level of acceptance on the other hand, we wanted to understand why it was so. And we argued that there are two important contributing factors. The first one is an alignment of interests between villagers and rural authorities. And there was a shared interest in minimizing the potential dangers of COVID-19. Importantly, there was a consensus on the dangers of the virus and the necessity of lockdown between villagers and rural authorities. And built on the consensus, village leaders made many arrangements to cushion the negative implications resulting from the lockdown. This included the delivery of food and other essentials, conducting temperature checks of suspected cases, and accompanying patients to hospitals. And perhaps equally importantly is that the alignment of interest hinged on close networks between groups and social cohesiveness. In villages, the communities tend to be kin-based and clan-ruled, so there are close networks between village officials and villagers. And in addition to village officials, the lockdown involved large numbers of volunteers. And in normal times, they had other occupations, but during the pandemic, they volunteered to help with enforcing the rules. And their participation kind of further blurred the line between village officials and villagers. And the second key contributing factor is flexibility in lockdown implementation and room for negotiation. There is a body of literature in China studies on the flexibility of the authoritarian Chinese system. So basically the argument is that policymaking and implementation in China are bargained, fragmented, and adaptive. Our findings lend support to this line of arguments. We find that, first of all, lockdown measures were subject to local conditions, such as geographical structures and human resources. And in one of the case study villages, for example, the geographical structure was very complex and fragmented, and there was a lack of personnel to implement lockdown and organize food delivery. As a compromise, a much more relaxed form of lockdown was adopted, and people were allowed to go to grocery stores themselves. And the use of flexibility could also be found in the decision to accommodate farming demands. In one Henan village, for example, initially all the residents were strictly required to stay at home. But when the lockdown started to interfere with farming in early March, the village leaders quickly adjusted their strategy to accommodate the demand. So certain numbers of people were allowed to go to the field on a quota basis. And finally, a relatively lenient approach was adopted to those who failed to observe the rules. As I said earlier, in the face of initial resistance, the strategy was mainly to persuade people to comply. And another example is that some people attempted to water the vegetable patch close to their home. However, due to the strict form of lockdown measures chosen, this was considered to be against the rules. But when such cases were identified, typically during the village officials' patrol, they would call through their loudspeakers and people would return their home immediately after being warned, but no further action would be taken. In conclusion, based on the interviews with rural residents, we find that the lockdown measures adopted in Chinese villages were indeed radical in the sense that very strict form of lockdown was adopted when there was actually no confirmed case of infection. However, the local acceptance level of these measures was high, and many indicated very strong trust in their local government, not local, both central and local government. And this contradiction can be partly explained by, first, an alignment of interests between villagers and rural authorities, and second, tacit flexibility in COVID-19 adaptation strategies to tackle conflict. Of course, our study has limitations. First, we had relatively small samples in each village, although we tried to diversify our interviews through recruiting people from very different backgrounds, including both village leaders and villagers and villager volunteers, and from different socioeconomic backgrounds. But due to the small sample, the interviews may not have covered all important dimensions of lockdown experiences. And since the topic has been significantly politicized, it's very hard to further scale up the research to testify the earlier findings or to understand the unfolding impacts of COVID-19, especially for the rural residents. But despite the limitations, our findings highlight some nuances of ground level politics. The lockdown measures were not implemented as simple top-down coercion. Instead, they involved, importantly, the bottom-up localized response of villagers. And there was actually room for negotiation based on local circumstances. So for those who are interested, here some our work on this topic, and I'll leave it there and happy to take questions.
Yes, I actually have one or two questions for Monica. It's very interesting. I just one question: why do you particular go to the villages instead of like big cities? Is that some limitation there? And second, did you do the same studies in Australia? If you replicate the same study, because my understanding is in Melbourne, okay, I'm from Australia myself, okay, in Melbourne, they locked down for nearly 120 days, right? About 115 days or something like that, right? And in Wuhan, if my information is right, it's around 70 to 80 days, okay, total lockdown, okay? So will there be a big difference in terms, if you repeat this study in Australia or in Melbourne, what do you think will be a big discrepancies? And also the lockdown, like your present study, it seemed like the villagers, they really sort of like accept it, right? They're not like really against it, right? They sort of, this is good for us, you know, so it's okay, right? And I mean, that's the message I got from your research, right? So I'm just wondering if you do the same study in Australia or in Melbourne, what will be the difference, right? Yeah.
Thank you for the question. So I'll answer the first question first. At the time, we chose rural areas because we thought that there was already some research about urban China, and at the time, and rural areas the rural China was given less attention. And we wanted to understand because the health infrastructure in rural areas was very weak, and there are many vulnerable people concentrated in rural China. Many of them are the elderly people, and they are vulnerable to the disease. So we wanted to understand, because we consider them as being more vulnerable to this pandemic. So we wanted to understand their experience more. And that is why we chose rural China in the first place. And the second question, the Melbourne one, I think first, I think, yes, the the length, probably Melbourne, the lockdown lasted for longer time. But I think the form of lockdown is very different. I mean, in Wuhan or the villages, we conducted research. It was very strict form. It was like quarantine for everybody. They could not leave their homes, even in, I think in 3 out of the 6 villages we interviewed. So it was pretty much like everyone was quarantined, and the village committee members and volunteers delivered food and other essentials for them. They could not leave their home. But in Melbourne, there are at least 4 reasons that you could leave home on a daily basis. You can go to do your grocery shopping, and you can, and I think also work for some types of work, and also, but at least there are 4 reasons. So I think these 2 types of lockdown are very different. And I think if I repeat, I didn't do this research in Melbourne, but I think it would be very difficult to persuade people to adopt such strict form of lockdown in Melbourne. People would have very different opinions, and there will be a lot of arguments, I think, around the appropriateness of lockdown in Melbourne. But in rural areas, I think one fundamental thing is that they, as I said earlier, there are close networks, and I think there people like kind of share similar thoughts. Like they think this is really dangerous, and the government is really good for them. And I suspect that the views in Melbourne would be much diverse, especially given that people come from very different backgrounds, and people may not have that level of trust in the government. Yeah.
Okay. Sorry, just one more. Is anyone have any question? If I have another one. I just want your personal, because you're doing the research, your personal opinion. Okay. The Chinese people, I know Chinese, the culture is a bit different from the Western culture. Okay, I assume in Australia you'll be following more Western type cultures. Okay. Do you think the Chinese people, when it comes to this kind of situation, okay, do they trust the government? Okay, whatever the government say or whatever the government inform them, do you think they fully comply? And compared to like in Australia, I mean, for say example, this lockdown, okay, and I think a lot of Australians that go out and protest. I mean, I also hear a lot of news as well in Melbourne, okay, they fight with the police and all these things, okay. And is that something to do with the trust, or is it because of the culture different, okay? I think in Western culture, it's more like, freedom, everyone, it's like my life, I want my freedom, those type of mentality, freedoms first and life second. Is that those type of mentality? And I think Chinese culture will be life first and freedom second. So I rather live and have without some freedom, and then rather die than with all the freedom I have. You know what I mean? Mm-hmm. Like in America, my life, my choice, those kind, I see those kind of protests, they have this kind of post, okay. Yes, of course, your life, your choice. But what happens if you get sick, right? What happens you really get sick? The ramification it affects, the whole medical system is affected, right? So I don't know. Do you have any comments?
Personally, I think culture is probably part of the answer, because I think I've seen some research saying that even in the Western context, Asian people with an Asian heritage are relatively more fearful of the disease, and they are more likely to adopt those those preventive measures. But I think, of course, but I think the factors influencing the trust in government, that's a very complex picture, and I think culture can only be a small part of the answer, because I think media also played a very important role. Like in the West, you can say you can see those news reports criticizing the government all the time, and when they say see the government does something wrong, they may criticize very harshly. But in China, you just don't have such an environment first. And I think social composition is probably also part of that. As I said earlier, I think in rural areas, especially in rural China, I think the social composition is probably more unified. People share more similar backgrounds. But in a Western context, especially such as Australia, there are many immigrants coming from different countries. And I think when this happens, it's less, they may have lower level of trust in the government because of the foreigners or something like that. Yeah, that's my personal view.
Hi, Monica, I have a question. So I kind of doubt the story. I think it is too perfect, right? You know, everyone is obedient, and the government takes care the needs of local people, and there's no conflict. So it's I did not do the research, but I kind of doubt it according to my past experience in the Chinese countryside, because for example, from my friends or from the internet, I can see a lot of complaints about the lockdown policies. People complain it's too tough, it's unnecessary, or it's too radical, too extreme. And also, according to my experience, I think life in isolation or life under the lockdown would be more difficult or more, less convenient for rural people than it is for the urban people. I'm not saying the rural people cherish more about, freedom or liberty. I'm saying they concern their convenience of life because they, for example, they can't use the online shopping, and their life is more, based on the mutual help between the neighborhoods. So I expect, at least some complaints or some resistance. Maybe the resistance is under the table from the rural people. So I'm not sure if you notice it in your interview, or have you involved any, questions in your interview? Thank you.
I completely agree with you. First, I was not able to show every detail of my interviews in a very short presentation. So yes, you're right. There are, of course, there are some people who are less positive, and but the overall picture we got was quite positive. So that's why I highlighted that part in my presentation. And I think an important thing is that because the topic has been politicized very much, so I also have this concern. I think maybe some people, they are unhappy, but they are very likely to hide their unhappiness. And I think we had some cases that we approached the interviewees first, but they just say that they don't want to comment on anything related to COVID-19. So I suspect that those people are probably more unhappy about this, but there is not much we can do. So what we could do, the best we could do was to ensure the interviewees that they will remain anonymous, and we will protect their privacy at all times. But that's the best we can do. If they don't want to participate, want to share their opposition or resistance, I don't know. But I think that's definitely a limitation of the study, and I agree with you.
I understand. Thank you.
Finally, thank you for the presentation. So I also have a question kind of related to the first question about the case you chooses. Because I want to ask, how peculiar you think the case is? Like, is that just a village, or it's many villages like that, or it's many villages in that particular province? Because as far as I understand, many provinces in China may have total different stories, like they may not even have lockdown or in far less scale, for lower scale. And so how do you, well, first of all, I don't even know how long is a lockdown last in this particular case. And do you think how common is this case across China villages? Thank you.
Okay, so answer the easy part first. The lockdown lasted from late January 2020 to about late March 2020. So around 3, is that 3? 2 or 3 months. And we chose 4 villages in Henan because we wanted to understand Henan. And these 4 villages are located in very different areas, and the interviews were done by different people actually, because during the first round the interviews were done by our collaborator, and in the second round I wanted to make sure that the interviewer knows the villages very well. So I recruited college students inside China, and so they basically did the interviews inside their hometown villages. And I hope that this can make sure that the people know them, and the people know that they will not harm them, and we can more likely to get the real answer. And so probably we have some representation for Henan, but beyond Henan, and in the second round, we also did interviews in Hubei, because Hubei is the epicenter. But beyond these 2 provinces, I really have no idea. And I think probably the picture would be very different. And because, as I said earlier, we chose Henan in the first place because it was reported in the news that it was pioneer in implementing the strictest forms of lockdown. So we wanted to understand Henan. But yes, again, beyond these 2 provinces, I'm not sure.
So I'll just round up this session by thanking all the speakers